Thank you for being here today. It's not just another talk, it's a commitment to your health, your energy, your clarity, and most importantly, your longevity. The science is clear. How we age is not purely genetic, it's behavioral, it's nutritional, and it's deeply connected to how we support our biology. Taking magnesium, vitamin D3, and vitamin K2 at the correct times is not just a small adjustment. It's a powerful strategy that can significantly influence how your body absorbs and utilizes these essential nutrients. Timing matters because our bodies operate on a biological clock known as the circadian rhythm, which affects hormone levels, digestion, sleep, and even how our cells process vitamins and minerals. When magnesium, D3, and K2 are taken in alignment with these internal rhythms, they are more bioavailable, meaning your body can absorb and use them more effectively. For seniors in particular, optimizing absorption becomes increasingly important as nutrient absorption tends to decline with age. Taking supplements at random times without consideration for the body's natural cycles may lead to suboptimal results, and in some cases, could even cause negative interactions or inefficiencies. Magnesium, for instance, is best taken in the evening. This is because it plays a key role in promoting relaxation, regulating sleep, and calming the nervous system. Taking it in the morning may not be as effective and could even make some individuals feel slightly fatigued or foggy due to its calming effects on the brain and muscles. In the evening, especially about 1 hour before bedtime, magnesium helps activate the parasympathetic nervous system, often referred to as the rest and digest system. This supports a deeper and more restorative sleep, which is critical for recovery, brain health, and overall longevity. For seniors whose sleep quality may decline with age, taking magnesium at the right time can be a simple but powerful intervention to improve sleep and reduce nighttime awakenings. Vitamin D3, in contrast, is best taken in the morning or early afternoon, ideally with food that contains healthy fats. D3 is closely linked to our exposure to sunlight. Taking it in the morning mimics natural sun exposure, which can help reinforce the body's circadian rhythm and avoid disruption to sleep patterns. When D3 is taken late in the day or evening, it may interfere with melatonin production and make it more difficult to fall asleep. Seniors who are not regularly exposed to sufficient sunlight often suffer from D3 deficiency, which can lead to a wide range of issues, including weakened bones, low mood, and impaired immune function. By taking D3 earlier in the day and pairing it with a fat-containing meal, the body is better able to absorb and utilize this critical hormone like vitamin. It also aligns with how our ancestors would have naturally synthesized D3 from morning and midday sunlight exposure. Vitamin K2, which plays a crucial role in directing calcium into the bones and away from arteries and soft tissue, is best taken alongside D3 during the same meal. K2 enhances the effects of D3, making the combination far more effective than either supplement taken alone. However, the synergy is only achieved when timing and pairing are correct. Taking K2 on an empty stomach or at night without food may reduce its absorption and limit its benefits. Since both K2 and D3 are fat-soluble, taking them together with a meal that contains some fat is essential. Seniors who are focused on bone health and cardiovascular longevity should pay close attention to this combination. The correct timing ensures that calcium is directed where it's needed most, into the skeletal structure, and not into the arteries, where it can contribute to calcification and cardiovascular risk. It's also important to consider medication timing and interactions. Many seniors are on prescription medications, and some of these can affect or be affected by nutrient timing. For example, magnesium can interfere with the absorption of certain antibiotics and medications if taken too closely together. Therefore, a gap of 2 to 4 hours should be maintained between magnesium and certain medications. Likewise, those on blood thinners should consult a healthcare provider before taking vitamin K2, as it may affect clotting mechanisms. Understanding these factors and timing supplements accordingly is crucial to maximizing benefits and minimizing risks. Another factor is consistency. The body thrives on routine, especially as we age. Taking supplements at the same time each day trains the body to expect them and often results in improved digestion and absorption. Just as the body regulates sleep, hunger, and energy through rhythm and predictability, nutrient absorption can also become more efficient when it follows a consistent daily pattern. Seniors who take their supplements at different times each day may unknowingly reduce their effectiveness. Setting a daily schedule such as magnesium 1 hour before bed, D3 and K2 with breakfast can create a system that's both easy to follow and biologically aligned with how our bodies work. Hydration and gut health also play supporting roles in absorption. A dry digestive tract or poor gut microbiome can limit the effectiveness of even well-timed supplementation. Drinking sufficient water throughout the day, consuming fiber, and including fermented foods can help improve the gut environment. When the digestive tract is healthy, the nutrients have a better chance of being fully absorbed, especially fat-soluble ones like D3 and K2. Seniors who suffer from constipation or poor digestion may find that these strategies enhance the effectiveness of their supplements. Incorporating movement, such as a short walk after meals, can also improve nutrient absorption and metabolism. This ties back to timing as well. For example, taking D3 and K2 with a healthy breakfast followed by a walk can simulate the natural rhythm of morning light exposure and nutrient use. Later in the day, taking magnesium after dinner and then winding down for sleep supports the body's natural evening processes. This approach makes the supplements work with your biology, not against it. In summary, the correct timing of magnesium, D3, and K2 is not just a detail, it's a fundamental principle rooted in human physiology. By aligning supplementation with the body's natural rhythms, seniors can dramatically improve absorption, efficiency, and overall health outcomes. With just a few simple changes in timing, the full benefits of these critical nutrients can be unlocked for better energy, stronger bones, improved sleep, and longer life. Combining vitamin D3 with vitamin K2 is one of the most important yet overlooked strategies in achieving optimal health, especially for seniors. Many people take vitamin D3 to support their immune system, improve bone strength, and boost overall vitality. However, very few understand that D3 alone can sometimes lead to unintended consequences if not paired correctly with vitamin K2. The reason this combination is so essential lies in how these two nutrients interact with calcium within the body. Vitamin D3 increases calcium absorption from the gut into the bloodstream. While this is beneficial for maintaining strong bones and teeth, it creates a risk if that calcium is not properly directed to the right locations. That's where vitamin K2 comes in. It acts as a biological traffic director, guiding calcium away from the arteries and soft tissues and into the bones where it belongs. Without enough K2, the calcium elevated by D3 may end up depositing in arteries, joints, and organs, potentially contributing to calcification and long-term health issues like arterial stiffness and cardiovascular disease. For seniors, this balance becomes even more critical. As people age, the ability to regulate calcium decreases and the risk of arterial calcification naturally increases. Taking high doses of D3 without adequate K2 may inadvertently accelerate this process, defeating the purpose of supplementation altogether. On the other hand, when D3 and K2 are combined properly, they work synergistically to not only increase calcium levels, but to ensure it is safely and effectively utilized. This supports bone mineral density, reduces the risk of fractures, and protects the cardiovascular system, which is often a major concern in older adults. The precision of this interaction is rooted in science. D3 increases the production of osteocalcin, a protein that binds calcium to the bone matrix. But for osteocalcin to be activated, vitamin K2 is required. Without K2, osteocalcin remains inactive and calcium cannot bind efficiently to bones. This leaves the calcium free floating in the bloodstream, where it may end up causing harm. K2 also activates another protein called matrix GLA, protein ZMGP, which prevents calcium from depositing in arteries. These two actions combined show just how indispensable K2 is when D3 is being supplemented. There are different forms of vitamin K, and K2 is the specific one required for this process. Within K2, there are several subtypes, with MK7 being the most bioavailable and long-lasting in the body. Seniors should aim for a daily intake of K2, MK7 alongside their D3 to ensure continuous support of calcium regulation throughout the day. Dosage matters too. While many seniors are prescribed or self-administer large doses of vitamin D3, such as 2,000 IU to 5,000 IU daily, the intake of K2 often lags far behind. That's included, all this imbalance can be corrected by including 100 mcg to 200 mcg of K2 MK7 with the daily D3 dose. These nutrients should ideally be taken together during a meal that includes dietary fat, as both are fat soluble and require fat for optimal absorption. Clinical research supports this approach. Numerous studies have shown that the combination of D3 and K2 improves bone strength more effectively than D3 alone. Other studies have demonstrated that K2 supplementation can reduce arterial stiffness and even reverse early signs of vascular calcification. This is crucial for seniors who often deal with hypertension, high cholesterol, and other risk factors that make their cardiovascular system more vulnerable. Proper calcium management through D3 and K2 can help protect arteries from narrowing, improving blood flow, and reducing the risk of heart-related complications. Another overlooked aspect is that K2 is not widely present in most modern diets, especially in Western countries. While D3 can be synthesized from sunlight, K2 is mainly found in fermented foods like natto, a traditional Japanese dish, or in smaller amounts in cheeses and animal livers. Most seniors do not consume these foods regularly, making supplementation even more necessary. A D3 and K2 regimen becomes an essential part of a preventative health strategy, especially in environments or lifestyles where nutrient-rich food sources are lacking or sun exposure is minimal. Timing and consistency further amplify the benefits. Taking both D3 and K2 at the same time each day, preferably in the morning or with the first main meal, ensures they enter the system together and can act in concert. Skipping days or taking them at irregular times can reduce the effectiveness of their synergy. The body thrives on rhythm and consistency, and nutrient signaling pathways benefit from predictable patterns. Seniors who maintain this habit are likely to experience not only better results in lab tests and bone scans, but also improved physical performance, reduced joint discomfort, and greater overall energy. Combining these two nutrients is not just a nutritional hack, it's a biological necessity. The science is robust and practical, and the impact is real. Seniors looking to extend their mobility, protect their hearts, and maintain cognitive sharpness should make this combination a non-negotiable part of their daily wellness protocol. It's a simple act with profound implications, correcting a common mistake and replacing it with a strategy that truly works with the body instead of against it. By understanding and respecting the need for synergy between D3 and K2, individuals unlock a powerful health advantage that supports longevity, vitality, and resilience at any age. Magnesium is one of the most vital minerals in the human body, yet it is often underappreciated and chronically under-consumed, especially among seniors. It is involved in over 300 biochemical reactions, playing a role in everything from muscle function and nerve transmission to energy production, blood pressure regulation, and DNA repair. Despite its critical importance, studies show that a significant percentage of older adults are deficient in magnesium. This is due to a combination of factors, including dietary insufficiency, decreased absorption with age, increased loss through medications, and chronic health conditions that interfere with magnesium balance. This widespread deficiency often goes unnoticed because its symptoms can be vague or attributed to aging, such as fatigue, muscle cramps, irregular heartbeat, anxiety, and sleep disturbances. The human body does not produce magnesium, which means it must be obtained through diet or supplementation. Foods rich in magnesium include leafy green vegetables, nuts, seeds, whole grains, and legumes. However, the modern diet often lacks these components, especially among seniors who may have reduced appetite, digestive issues, or dietary restrictions. Cooking and processing food further depletes magnesium content. On top of that, medications commonly used by older adults, such as diuretics, proton pump inhibitors, and certain antibiotics can cause magnesium to be lost through urine or reduce its absorption in the gut. This creates a perfect storm where the body is gradually drained of this essential mineral over time, leading to subtle but significant health issues that accumulate and intensify. Magnesium is especially important for heart health. It helps maintain a steady heartbeat and regulates blood pressure by relaxing blood vessels. Low magnesium levels have been associated with increased risk of hypertension, arrhythmias, and cardiovascular disease. Seniors who are already at higher risk for these conditions can benefit tremendously from ensuring their magnesium levels are adequate. Supplementing with magnesium can help normalize blood pressure and improve heart rhythm, which not only reduces the risk of serious cardiovascular events, but also enhances energy levels and quality of life. Magnesium also plays a key role in maintaining healthy bones. While calcium and vitamin D are often emphasized for bone health, magnesium is just as crucial. It assists in the conversion of vitamin D into its active form and helps regulate calcium transport and metabolism. Without sufficient magnesium, calcium may not be deposited effectively in the bones, and vitamin D may not function properly. This can lead to weakened bones and increased risk of fractures, a serious concern for seniors. Incorporating magnesium ensures that the other nutrients in a bone health protocol, like calcium, vitamin D3, and K2, are able to do their jobs effectively and safely. One of magnesium's most immediate and noticeable benefits is its effect on the nervous system. It supports the balance of neurotransmitters, helping to calm the brain and improve mood. Seniors who struggle with stress, anxiety, irritability, or cognitive decline may find that magnesium supplementation improves their mental clarity, reduces anxiety, and enhances overall well-being. It works in part by regulating GABA, a calming neurotransmitter that reduces excitability in the nervous system. When magnesium levels are low, the brain can become overactive, leading to restlessness, irritability, and even sleep difficulties. When levels are optimized, a sense of calm and balance is often restored. Sleep is another critical area where magnesium has profound impact. It helps regulate melatonin, the hormone responsible for sleep, wake cycles, and promotes relaxation of muscles and the nervous system. Seniors who suffer from insomnia, restless legs, or nighttime cramps often find relief from magnesium taken in the evening. It can enhance the depth and quality of sleep, leading to improved daytime energy, mental clarity, and physical resilience. Since sleep plays a foundational role in immune function, memory consolidation, and tissue repair, the benefits of better rest extend to virtually every system in the body. There are several forms of magnesium available, and choosing the right one is important. Magnesium glycinate and magnesium threonate are two of the most bioavailable and well-tolerated forms, especially for seniors. Magnesium glycinate is particularly good for promoting relaxation and sleep, while magnesium threonate may have specific benefits for cognitive health and brain function, as it is able to cross the blood-brain barrier. Magnesium citrate is effective for digestion and bowel regulation, but may cause loose stools in sensitive individuals. Tailoring the type and dosage to the individual's needs and tolerances is key to maximizing benefit. The timing of magnesium intake also influences its effectiveness. Since magnesium promotes relaxation and supports sleep, it is generally best taken in the evening, about an hour before bedtime. This allows it to support the body's natural winding down process and enhance rest. Taking magnesium at night also aligns with the body's circadian rhythm and the natural dip in cortisol that occurs in the evening. This synchronization can make a noticeable difference in sleep quality and next day alertness. Hydration is another factor that affects magnesium balance. Seniors are more prone to dehydration, which can exacerbate magnesium deficiency and lead to symptoms like muscle cramps, headaches, and fatigue. Ensuring adequate water intake throughout the day can support magnesium absorption and utilization. It also helps maintain electrolyte balance and supports kidney function, which is crucial for regulating mineral levels. Magnesium's influence on aging is broad and powerful, from improving energy metabolism to supporting cardiovascular, bone, brain, and muscle health. It is an essential part of any longevity strategy. For seniors who are at higher risk of deficiency and its consequences, recognizing the importance of magnesium and ensuring adequate intake can be a life-changing step toward maintaining vitality and independence. It's not just a supplement, it's a fundamental nutrient that works silently in the background to support every major function of the body. Restoring magnesium to optimal levels is one of the most effective evidence-based actions any senior can take to support long-term health and well-being. Daily light exposure and supplement timing are too often overlooked but critical components of any longevity and wellness strategy, especially for seniors. Our bodies are deeply connected to natural light cycles, and this relationship governs everything from hormone production and sleep quality to metabolism, mood, and immune function. Light serves as the master regulator of our internal clock, known as the circadian rhythm, which controls nearly every physiological process in a 24-hour cycle. Disruptions to this rhythm, whether through poor light exposure, erratic sleep schedules, or mistimed supplement intake, can cause cascading effects on health. For seniors whose circadian rhythm can become less robust with age, the need to intentionally reset and support this internal clock through morning light and timed supplementation becomes even more essential for maintaining vitality and longevity. One of the most powerful actions a senior can take each day is to get bright, natural sunlight exposure within the first 30 to 60 minutes of waking. This morning light, even on a cloudy day, signals to the brain that it is daytime. This signal is sent via the retina to the suprachiasmatic nucleus in the hypothalamus, which governs the circadian rhythm. That input resets the body's internal clock, promotes the release of cortisol at the right time of day to promote alertness, and sets in motion the countdown to nighttime melatonin release. Without this signal, the body remains confused about what time it is, which can lead to fatigue during the day and restlessness at night. For seniors who may not get outside regularly or who rely on indoor lighting, this lack of strong natural light in the morning can dull the circadian signal and lead to chronic sleep disturbances, mood fluctuations, and diminished energy levels. In the context of supplements like magnesium, vitamin D3, and K2, light exposure and timing are deeply interwoven. For example, taking vitamin D3 in the morning, ideally with breakfast, and shortly after light exposure, aligns supplementation with the body's natural rhythm. D3 mimics the signal of sunlight, so taking it in the morning supports the biological expectation that light and D3 synthesis occur early in the day. Taking it late in the day or at night can confuse the body, potentially suppressing melatonin and interfering with sleep. Seniors who take vitamin D3 earlier in the day, especially after light exposure, are reinforcing the body's natural pattern of waking and alertness, which helps establish a more consistent and healthy rhythm over time. Magnesium, in contrast, supports the body's ability to wind down in the evening. It promotes relaxation, enhances GABA activity in the brain, and assists with melatonin regulation. When taken in the evening, usually 1 to 2 hours before bedtime, magnesium aligns with the body's internal signal that it's time to rest. Seniors often experience fragmented sleep, early awakenings, or difficulty falling asleep due to decreased melatonin production and changes in circadian signaling. Evening magnesium, combined with limited artificial light exposure at night and avoidance of screens before bed, can improve sleep quality, help reset the circadian rhythm, and make the body more resilient overall. Mistimed magnesium intake during the day may reduce its effectiveness and blunt its calming effects when they are needed most. Vitamin K2 works synergistically with D3 and should be taken at the same time as D3 with a fat-containing meal. While its timing is less connected to light cycles, its effectiveness is enhanced when the body is already in a state of biological alignment. This means taking it during the active phase of the day, not in the late evening when the body is winding down. The combination of K2 and D3 during morning hours supports bone health, cardiovascular function, and calcium regulation, while simultaneously working in harmony with the signals initiated by morning sunlight. Light exposure does not only reset the circadian rhythm, it also has profound effects on mood, hormone levels, and immune system regulation. Morning sunlight increases serotonin production, which lifts mood and promotes calm focus. This serotonin is later converted into melatonin in the evening. So getting light in the morning literally builds the chemical foundation for sleep at night. For seniors at risk of depression, seasonal affective disorder, or cognitive decline, morning light serves as a non-pharmacological, science-backed intervention with immediate and cumulative benefits. When paired with movement, such as a short walk outdoors, the effects are even more powerful. Walking in sunlight stimulates the body's systems to wake up and engage with the day, improving digestion, cardiovascular health, and mental clarity. These seemingly small actions compound over time to produce large improvements in well-being. The modern indoor lifestyle, especially among seniors who may be homebound or less mobile, deprives the body of its natural connection to daily light-dark cycles. Artificial lighting lacks the intensity and spectrum of natural sunlight and fails to fully activate the circadian system. Without the right light at the right time, the body's internal rhythm begins to drift. This affects not only sleep and energy, but also the absorption and effectiveness of nutrients and supplements. Supplements are not magic pills. They require the right biological environment to work optimally. That environment is set each day by light. Morning light tells the body it's time to be alert and active, while darkness in the evening signals rest and recovery. Ignoring this rhythm leads to internal confusion, which no supplement can fully correct on its own. Daily consistency is key. Just as supplements should be taken at the same time each day for best results, light exposure should also be a regular practice. Even 5 to 10 minutes of sunlight exposure early in the day can make a significant difference. For those unable to get outside, sitting near a bright window or using a full-spectrum light therapy lamp in the morning can be a helpful alternative. Seniors who prioritize both light exposure and proper supplement timing can expect to see improvements in mood, energy, sleep, cognitive clarity, and overall health resilience. This synchronization between natural light, biological rhythms, and nutrient intake is not complicated, but it is powerful. It requires mindfulness, routine, and a commitment to aligning with the body's evolutionary design. The goal is not just to take supplements, but to take them at the right time and under the right conditions so the body can fully use them. When seniors integrate daily light exposure and supplement timing into their lifestyle, they tap into a foundational health protocol that supports longevity, enhances vitality, and protects against many of the challenges associated with aging.